Hi, my name is Greg Felt. I'm Director of Public Health in Sheffield. This is a short piece on self-isolation, common mistakes and myths. The most important piece of the test and trace system is the self-isolation bit. There's no point in requesting a test. There's no point in contact being traced if people don't self-isolate. It's the most important thing to do to reduce the spread of the infection. It basically breaks the chain of transmission. And it's the single most important thing you can do to help stop the spread of the virus to you and your loved ones. So in your household, if you are infected, by the statistics, somewhere between a third and a half of the other members of your household will become infected. Isolating yourself within your household is quite important, and there are some other things that we can do to reduce spread of infection in households. So a little recap: self-isolate immediately if you have any symptoms of coronavirus, high temperature, a new continuous cough, or a loss or change to sense of smell or taste. Isolate if you've tested positive for coronavirus. That means you've got coronavirus if you've got a positive test. If you live with someone who has symptoms or test positive, isolate. If someone in your support bubble has symptoms or has tested positive, or if you're told to self-isolate by NHS Test and Trace or the NHS COVID-19 app. So for any of those reasons, you should self-isolate. There are some misconceptions about self-isolation when one or more of the above circumstances overlap. For instance, if one of your contacts has tested positive, you will be contacted to self-isolate for the next 14 days. During that time, if you have a test or don't have a test, you will still need to self-isolate for that duration of time, because it can take a while for the virus to appear and your negative test result, if you get a negative test, maybe a false negative. So if you're told to isolate for 14 days, you should isolate for 14 days. A negative test doesn't release you from isolation. The impending lockdown doesn't affect the self-isolation rules, and self-isolation does mean just that. It means don't go to work, school, public places, or don't use public transport or get taxis. Work from home if you can. It does mean don't go out on to get food or medicine, order it by phone, or ask someone to bring it to your home. Don't have visitors in your home, including friends or family, because they will become contacts. Except for people who have to provide essential care, and don't go out to exercise in your home or garden if you have one. If you're on a low income, or you'll lose income because you're self-isolating, you can apply for a payment of up to £500. The COVID-19 emergency assistance grants are also provided to support Sheffield residents who are having difficulties in paying for food or other essentials due to COVID-19, and more details will be available, and the links will be available at the end of the video. So it remains the most important thing we can do to break the chain of transmission. So thank you for doing it, and if you're asked to self-isolate, please do so.